Hey guys, Dr. Eric, the fitness physician. So I'm doing a presentation on how to reduce your blood pressure or really normalize, optimize your blood pressure naturally. As you know, I'm all about natural health and getting to the root cellular cause of issues and problems and fixing them as naturally as possible. I want people to escape the trap of big pharma, big government, etc., that's flooding our bodies with toxins and making us weak, sick, fat, and dumb by keeping us scrolling, exposed to radiation, toxins in the food, bullshit in the air and the water. I apologize for cussing, but I'm very passionate about this. I want my Primex tribe to be as natural and healthy as possible. Yes, I will use bioidentical hormones and natural supplementation, but I'm try to do all the free natural stuff first: lifestyle, diet, exercise, and nutrition, and more. But and again, blood pressure, just like many other disease processes, are so quickly with the modern medicine. The sick care model is just you pills for the ills, just putting everybody on pills and just and rinsing and repeating. And there's always a better way, whether it's cholesterol, blood pressure, or more, or depression. All these can be fixed and modified naturally. Occasionally, there'll be a need for a medication, and I still use them as needed, but most of the time they can be avoided. So I won't have to get detailed nuance of high blood pressure. We all know it's a major problem, and cardiovascular disease is the number one killer of men and women. And high blood pressure is one of the things that contribute to them. So it is important to optimize this. Over a billion adults between 30 and 79 have high blood pressure, and an estimate almost half, 50% of adults with hypertension are unaware that they even have it because it's asymptomatic. That's why they call it the silent killer. Less than half of adults are diagnosed and treated, and 1 out of 5 adults have it under control. So again, it's a major cause of premature worldwide death worldwide, and it's a target to reduce this. And again, a leading risk factor for cardiovascular disease. Again, the danger: 7 out of 10 people having their first heart attack have high blood pressure. 8 out of 10 having their first stroke have high blood pressure. 7 out of 10 people with long-lasting heart problems have high blood pressure. And you got increased risk of dementia, of endothelial dysfunction, or blood pressure abnormalities, which can affect everything. It can affect your brains, your heart, your kidneys, sexual dysfunction in men, and so much more, as indicated on this graphic here. So in general, again, these numbers change off and on throughout the years, but in general, less than, ideally want a systolic, a top number less than 120, the bottom number of the diastolic be less than 80, ideally is what you want, right? So, and anything above that, as you can see on the screen, is elevated to high, and we want that obviously optimal. So what can we do? You know me, I like to cut right to the chase. What are we going to do to fix this naturally? So number one is exercise. A lot of people think, yeah, I know, but they did some studies on this, and a lot of these can reduce blood pressure. Of course, we know about all exercise, but isometric exercise actually had the biggest benefit. And isometric meaning holding in a static position with resistance. So we're talking wall squats, hollow body holds, planks, lunges, things where you're holding your muscle tension. These isometric exercise had a drop in blood pressure of over 8 points on the systolic and over 4 on the diastolic. And when you combine this with others, almost a significant bump as well. And then dynamic resistance. And of course, we all know cardiovascular exercise, aerobic activities does benefit as well. So as you know, I recommend all of them. You do strength training, you do cardiovascular, do combination, but isometric is a cool little thing that you can add in and get the most bang for your buck, right? So again, an effectiveness of 98% with isometric, combined 75% effectiveness and dynamic resistance training, 46%, aerobic 40%, and HIIT about 39. So again, obviously you want to do all of these, right? It's great for not just blood pressure, but overall cardiovascular health, muscle strength, and so much more. But isometric gives you the most bang for the buck. So like I said, isometric exercise like a wall squat, hollow body hold, oops, sorry for the typo, overhead hold, incline push-ups, planks, V-sits, lunges, calf raises, and more. So the biggest bang for your buck are things like wall squats, hollow body holds, etc. So these are some very simple things you can mix into your current routine. They do not take terribly long. You can do them every day or just several times a week. So let's talk about minerals and electrolytes. The biggest thing that I see and most commonly is imbalance, especially with potassium and sodium. Most people have low intake, and there's a very most commonly there's insufficient potassium. We're not getting enough potassium. A lot of people are getting a lot of salt, especially artificial crappy table salt, which is terrible because it has so many other things in it that you don't want. If you want salt, you want a good Celtic or Himalayan sea salt, but mostly we need more potassium. Most people have enough salt, and I'm not poo-pooing salt. I think some people actually need more salt, but so I don't think it's super dangerous. But the biggest thing is to balance it with plenty of magnesium, plenty of potassium. So potassium, you could do almost 4 grams of potassium a day, and the best source is fruit, of course, fresh fruit, and you can get it some from vegetables as well. Easy to supplement naturally with food. Magnesium as well, where you can get from food, but it's very difficult. That's why I almost always recommend everybody supplement with a magnesium, a good quality magnesium, because it balances out. It works on the sodium potassium pumps and so many other functions in the body with potassium to regulate not only your electrolytes, but can effectively affect your blood pressure by altering the tone in your blood vessels. Right, magnesium is also a natural calcium channel blocker, and it competes with sodium. So geeky talk, basically this means, again, it kind of balances things out and you want your blood vessels pliable and soft. And this is how it works. And again, like I said, magnesium is huge. It does hundreds of functions in the body. Again, it competes with sodium binding sites on the vascular smooth muscle cells. It can increase prostaglandin E, which leads to vasodilation and improved endothelial function. And it's a cofactor for the delta-6 desaturase enzyme, which is the rate limiting step for conversion into GLA, which GLA leads down that road to prostaglandin E1, which is a vasodilator. And it's also a platelet inhibitor. So it can improve the tone of your blood vessels, therefore improving your blood pressure and improve your platelet function, decrease clotting, right? Decrease risk of clots and things like that. So again, it's reduction of vascular tone with its effects on calcium, sodium, potassium, and pH. And again, you want to mix them. You want calcium, potassium, magnesium, and all of them. But again, most people just don't get enough magnesium and potassium. Again, no unprocessed salt, not very good for you. Again, Celtic or Himalayan sea salt is best. Mineral-rich food, magnesium-rich foods, or supplementation. I like magnesium glycinate and threonate or orotate. Those are the best, right? And you can also use a spray at night as well to help with sleep. You want to avoid things, processed foods, of course, grains, trans fats, PUFAs, polyunsaturated fatty acids, and seed oils, canola oil, corn oil, all those natural oils. The only oil you should be having is coconut oil, maybe some and good high quality olive oil, but be careful. A lot of them are cut with canola oil, so you want to be careful. So these are the biggest things because you're going to get a lot of extra junk in there that you do not want, which is going to adversely affect your blood pressure and much more health-wise. And again, avoid super low salt most of the time because if you're not getting enough salt at all, your body's going to compensate and raise aldosterone, which is going to increase blood pressure. A lot of the whole too much salt is bad for blood pressure is kind of a myth. There are some people that do benefit from a low salt diet, but across the board, most people are just getting the wrong kinds of foods. So you want to, again, it's all about balance. So let's talk about herbs, right? Herbs are natural, a very easy thing to do. They mimic the effect of low antihypertensive, meaning blood pressure medicines. They block an enzyme called ACE, the angiotensin converting enzyme, which is well known to contribute to blood pressure, inflammation, and much more. They are powerful antioxidants, scavenging reactive oxygen species, reducing oxidative damage and inflammation, improving endothelial health. They act on the calcium channels and also improve nitric oxide production, which leads to vasodilation, or the dilation of the blood vessels. They're also anti-inflammatory. They can lead to angiogenesis, which is the growth of new blood vessels, which is obviously can help with vascular tone, meaning your blood pressure and heart health, performance, and more. And it's going to help with diuresis, meaning peeing everything out, and amine depletion, meaning get rid of extra catecholamines. So too much catecholamines, meaning like epinephrine, norepinephrine, meaning like adrenaline, is what most people think of. And that's obviously adrenaline is going to jack up your blood pressure by constricting the blood vessels. So herbs can reduce this. This is a cool little graphic from a journal, and these are some herbs which I'll talk about that can lead to all these things. This is kind of a graphical representation where I talked about all these herbs can do these things to promote vasorelaxation of the blood vessels, increase dilation, and improve your blood pressure. Another cool graphic, how these all can lead, the things I just talked about, nitric oxide, the amine depletion, blocking calcium ion channels, endothelium, ACE inhibition, antioxidant, scavenging, reactive oxygen scavenging. And there's the herbs are listed there, which I'll talk about a few here in a minute. So hawthorn is a cool pretty little berry. And again, it improves nitric oxide and enos, or what's called endothelial nitric oxide signaling, to promote that nitric oxide in your blood vessels to cause them to relax. It's a very powerful antioxidant, anti-inflammatory, and can improve the cardiac myocytes, meaning the cells in your heart, to make them function effectively. And lots of flavonoids, which are very anti-inflammatory, very beneficial for heart health and vascular health. Hibiscus is, most people think of this as a flower, and it's an herb, an herbal tea. People have a hibiscus tea all the time. Again, it's a natural ACE inhibitor, which ACE inhibition is going to help improve that vascular tone, reduce inflammation, important for endothelial health, nitric oxide production. It's anti-inflammatory, and it's rich in anthocyanins, similar to what's in dark berries, to help massively reduce reactive oxygen species, inflammation, and oxidation. Tribulus, a lot of guys have heard about tribulus for testosterone, kind of plus minus on that, but the biggest thing here is it helps with blood vessel growth, angiogenesis. It's a mild diuretic and has saponins, which reduce oxidation and excessive growth of vascular smooth muscle cells. And has all these flavonoids, alkaloids, and glycosides like quercetin, camphorol, and all these things reduce inflammation, improve nitric oxide production, and again, blocking ACE inhibitors. They're more of an ACE inhibition function. Everybody's heard of ginseng. It's an adaptogen. It leads to vasodilation, nitric oxide production, catecholamine reduction, antioxidant, anti-inflammatory effects, and dilation of the endothelium. And it has calcium channel blocking effects. So it has a lot of benefit on this. And of course, a lot of people think about it for its nootropic effects or its effects in the brain and memory, which it does. So it's a very powerful adaptogen that does many functions in the body. And of course, good old green tea, Camellia sinensis, it's anti-inflammatory and antioxidant. And the EGCG leads to vasodilation and nitric oxide production. So you can drink green tea. EGCG is also available in a supplement form, which gives a little more bang for the buck. But again, a very natural product, very easy to do. Black cumin seed, I love this one. It's a Nigella sativa. It blocks calcium channels. Again, that ACE inhibition, common theme here, has thymoquinones and other compounds, again, that lead to vasodilation and inhibition of the COX enzyme, which is also blocked by aspirin, right? It's excessive COX activity. It's an enzyme that leads to inflammation if it's out of control. So this can help with endothelial health, anti-inflammatory effects, antioxidants, and more. So black cumin is a cool little thing. This is actually the bag that I get, and I just put it in my smoothies or my oats, if I have oats with protein powder, etc. And it gives a nice little flavor. It has a lot of vascular effects, has other beneficial effects on your metabolism as well. Good old garlic, keep the vampires away, and allicin is the active ingredient, which again leads to vasodilation, ACE inhibition, nitric oxide production, and natural anti-inflammatory and antioxidant. It also helps with modulating cholesterol levels, which is also beneficial for our overall cardiovascular health. Celery, the seeds or juice, again, they reduce catecholamines. They have a little product called NBP, and also flavonoids like apigenin, which a lot of people have heard about apigenin. And it has calcium channel blocking effect. It can help with vasodilation. It's great for nitric oxide production. And again, the natural anti-inflammatory effect and effect on cellular health, which is what I practice, cellular muscle medicine. Of course, good old ginger. That's what the plant looks like there. Ginger and chagold, it blocks the angiotensin receptor. Again, that pathway at the angiotensin that I was talking about. Has a good source of potassium, and again, blocks excessive ACE activation and calcium channel effects, so it can lead to increased vascular tone. Good old berberine. I love berberine. I use it for so many patients for so many things. Great for gut health, improving insulin sensitivity. But the Coptis chinensis is an alkaloid, and it blocks PGI2 and KATP, which again leads to vasodilation. And again, as I mentioned, metabolic effects it helps improve insulin resistance, PCOS, weight loss, and again, gut health and inflammation. So this is a very cool product, has many beneficial effects, very similar to metformin. In some ways, it's better. I feel like, and it's more natural, and some people like both, but it's a great product, has many, many beneficial effects on the body. And of course, polyphenols. I love the polyphenols. I tell everybody, load up on those dark berries, the dark chocolate. These are great for overall health, gut health, metabolism, insulin sensitivity, and reduction of inflammation, but especially for gut health and more. And good old nitric oxide. Nitric oxide support is crucial for proper vasodilation and endothelial health. A lot of people, we lose this function as we get older, especially if we're exposed to all the stuff and toxins that I was talking about at the beginning of the talk. So again, there's different ways to approach this. Of course, starting with diet, leafy greens, arugula, beets, all the polyphenols I was just talking about. Some people, and I definitely avoid mouthwash, avoid antacids, because these affect your gut, your microbiome in your mouth and your gut. And when you eat these foods, you need that microbiome to convert it from the nitrates into nitrates and to get that effect. And if you're doing those antacids and mouthwash, you're going to kill these bacteria. You're not going to get a beneficial effect. So you definitely want to avoid that. And you could also do nitric oxide support supplements. I use several quality products. I've met the founder of one of these companies, who's probably the best out there. And if you're interested, reach out to me. I've got some discount codes for these products to help you get some discounts on these. They're very great. There's only maybe 2 or 3 really good companies out there out of all these, and I can hook you up with that. If you're interested, DM me and I'll get that to you. Again, dietary nitrates, again, massive benefits. I know I'm going to do some talks about this. I could talk for probably 45 minutes just about this, but helpful in the brain, cardiovascular function, athletic ability by improving oxygen utilization, delaying muscle fatigue, improving endurance, works in the mouth in prevention of osteoporosis, works in the bones, liver, fat and pancreas by helping with fat burning, reduction of obesity, improvement of insulin sensitivity, regulating glucose and lipid metabolism, works in the gut to improve gut function, and works in the oral cavity. And dietary nitrates have so many beneficial effects in optimizing your nitric oxide function. Other vitamins, other things we could do, natural products, right? We talked about potassium, but vitamin K2 especially the MK4 and MK7 variants. They're very beneficial. A lot of people just don't get enough of this. It prevents abnormal calcification, promotes bone calcification. So it helps any calcium from going into your arteries and causing that plaque or that calcium formation. You want it going into your bones and not in your arteries. So it's going to help pull that out and good deposit where it's supposed to go. So it can reduce that fibrotic function. You don't want calcium getting fibrosed and getting calcified in your arteries. That's not what we want. And some people need to do some pretty high dose to reverse any calcium plaque and blockages. You can go up to 5 to 15 milligrams a day if needed for a period of time. So these are, I put everybody on vitamin D because most of us don't need it, but you have to balance this with vitamin K and magnesium. Vitamin D3, I just talked about this. And again, you want your levels well over in the 60 to 80 range. Again, hundreds of benefits. It's actually a hormone. It works on the metabolism, on many hormones, bone health, and of course, blood pressure. Serrapeptase, there's some systemic enzymes that can be beneficial for improving vascular function, very beneficial for reducing fibrosis and clots, and helping reduce any plaque or calcium buildup as well. Been very helpful for post-COVID and vaccine injuries. It improves the pliability and improves endothelial health, and it's a powerful anti-inflammatory. So serrapeptase is one, nattokinase, lumbrokinase, there are some of these are very helpful in this regard as well, and it's a natural product. And they're made from, a lot of these come from silkworms and other natural products. So gut health and liver health. Gut health and microbiome, as we're learning, is massively important, affecting everything, and they're definitely improving cardiovascular function and blood pressure. One thing you want to look at, and one thing I always look for on lab testing, is albumin. It's a marker and indicator of health and longevity, and it indicates how healthy your liver is. So the biggest thing here is you want to reduce inflammation, improve fatty liver and non-inflamed, what they call NASH, non-alcoholic steatosis, or fatty liver is very, very prevalent. And if you have that, you're going down the road of prediabetes, diabetes, and some issues. So you want to have optimal liver health. And again, you want your albumin to be over 4.5. A lot of studies have shown that the lower your albumin, the worse off you're going to be in terms of longevity and overall health. So you really want that high, and you want your liver function optimal to process everything. It has to detoxify your body and process everything. And the gut health, liver health, massively important for cardiovascular function and so much more. But I know in this talk, we're talking about blood pressure. So again, you want to optimize diet and your fiber, your hormones, and detox pathways. You want your liver optimally functioning and your gut health solid. And there's, again, a whole nother topic, how to improve your gut health, liver health. But the biggest thing you want to look for is improving your insulin sensitivity, improving your microbiome with proper diet, whole food diet, eliminating all the stuff that I talked about at the beginning, optimizing your hormones, make sure your detox pathways are running smoothly. So the glycocalyx is a very cool thing in your endothelium. So is an imaging of your endothelium, the inside lining of your blood vessel. It's like these little hair, like a little shag carpet, right? There's a microscopically thin gel-like layer. These are made out of glycoproteins, proteoglycans, and glucosaminoglycosides, encoding the side of the vascular endothelium. When this gets damaged, this can cause a problem. Everybody's familiar with leaky gut. This is almost like a leaky vessel. And when this glycocalyx gets damaged, this is what leads then all the things, any inflammation, toxins, they can get through to the endothelium and cause further damage. And so this glycocalyx protects you and optimizes your nitric oxide production, optimizes vascular function. So you want this glycocalyx in optimum health. And again, we do this by removing toxins, improving our blood pressure, reducing inflammation, or reducing oxidation. Again, there on the left is a healthy glycocalyx, on the right is unhealthy. You can see the difference there. So this is essential. And again, improving inflammation, this is number one. Number two, optimizing blood pressure. So again, cardiac health and vascular integrity, you want to, against leaky vessels, similar to leaky gut. So improve nitric oxide optimization. And there's many, many ways to do this, but this is a cool product from Quicksilver called Cardio Elite. Has Dan Shen, which has been studied to improve this glycocalyx function, Hawthorne, green seaweed, myrrh, and others. There's some other products like Arteriosil and other products that can help with maintaining this function as well. Okay, let's talk about some other free stuff outside of supplements. Meditation is very well known and clinically proven to work. You can do this just through mindfulness, just closing your eyes, being aware of your breath. There's transcendental meditation. There's movement exercise like yoga, qigong, and there's breath focused, and there's guided meditation. You could do this on your own. You can use this with apps. You can just close your eyes and focus on deep breaths. Many ways to do this. You can take 5 minutes out of the day, multiple times a day. You could do a longer session, but meditation is free. It's easy. Great way to reduce stress, improve cortisol. I talk about this all the time. And this is clinically shown in scientific studies to improve blood pressure. And it's free. So definitely do it. Let's talk about carbon dioxide. This is kind of often forgotten about. Oftentimes it's best to optimize this before you focus on taking, nitric oxide is very important, but CO2 is your body's primary source of vasodilation. It's a natural vasodilator, improves blood vessel function, right? And it also improves oxygen release. So a lot of people think carbon dioxide is bad and they're trying to, but most of us overbreathe. We're always breathing really fast and then you're blowing off your CO2. Your CO2 is low. When that goes low, people get like tingly because you're not getting enough. And the Bohr effect, the lower your CO2, the harder it is for you to unload oxygen. So you want a good high optimal CO2 level because it's going to make it easier for your blood to unload that oxygen to your cells where it's supposed to go, and you will actually recover better, breathe better. So that's why a lot of you watch like Royce Gracie and some of these really good competitors, they do a lot of breathing through their nose. They really focus on slow breathing as much as they can, because by keeping your CO2 levels high, you're going to release and enable your body to get more oxygen. So you're going to be able to breathe and perform better. It sounds a little contradictory, but it's true. When you're huffing and puffing like that, you're blowing off your carbon dioxide, then your body's holding on to that CO2 staying trapped in the blood, not going to the tissues. Then you get more short of breath, and it's a vicious cycle. One way to test this is what's called there's different tests. There's the Bolt test, the CO2 discard test. There are different ways to check this, but if you take 4 deep breaths and on the 5th breath, slowly exhale. And how long does it take you to exhale? It should be over 60 seconds or at least over 30 seconds, right? If you're taking longer to blow it out, that's not good. Or a lot of people will say you can blow out and then hold your breath on the exhale and see how long you can hold it. You want to try to get to over 30 seconds. This is hard, and it takes practice to work on this. So again, you have a low CO2, and it's more difficult for oxygen to go from the blood to the cell. So this is not what you want. So again, you want low CO2 is going to lead to higher heart rate, higher blood pressure. With a higher CO2, you get vasodilation. There's beneficial effects on inflammation, free radicals, nerves, and brain function. You also get dilation of the bronchioles, the tubes in your lung that gets you oxygen. It's improvement in amino acid synthesis and in glucose sensitivity too. It also improves immune health and metabolic pathways. So CO2 is huge. It works on every part of the body. It's not just your blood pressure. It does all these cool functions too. So you want to focus on slow and shallow breathing. So there's a lot of techniques out there. There's several authors who've written some great books on breath holding, like Buteyko breathing, controlled pauses, box breathing, where you breathe in for anywhere from 2 to 5 seconds, hold it on the inhale for the same amount of time on the exhale, and then same amount of time holding it on the exhale. 4-7-8 breathing, where you breathe in for 4 seconds, hold it for 7 seconds, and blow out for 8 seconds. And then there's breath hold walks, where basically you're walking, and you can do alternate nostril breathing, where you're just breathing in one side of the nostril while you walk, and then switch, and eventually just keep going back and forth. You can also, when you're walking, take slow deep breaths and periodically exhale, pinch your nose while you're walking, and see how long you can go. And then before you take a breath, and you don't want to go till you're gasping for your breath. When you start to feel that little bit of air hunger, that's when you let go. Most people are going to start with maybe 5 or 6 seconds, eventually be able to get to 10 seconds or more. But if you do this repeatedly during a walk, you're going to improve your body's ability to handle CO2 and produce CO2 and improve vasodilation. And of course, mouth taping. A lot of people are mouth breathers. So taping your mouth shut at night is very helpful. You want to focus on nasal breathing, slow abdominal breathing. Most of us breathe through the chest and breathe quickly. You want to breathe slow, shallow breaths through the abdomen. You should breathe into your back, as the book's saying. Feel your abdomen going out and your ribs expanding, not so much in the chest. And nasal breathing is huge. So these are very simple ways to optimize your blood pressure naturally. Of course, and then stress reduction. I didn't talk about this, but it kind of goes hand in hand with meditation. But stress is huge and it's a big contributor to blood pressure. It's almost always fixable. And again, whole food diet. If you're eating junk food, processed foods, alcohol, of course, these are going to affect your blood pressure. So by eating clean, exercising, focusing on your stress, and hitting some of these natural strategies, you're definitely going to improve your blood pressure naturally. Very rarely we have to go on blood pressure medicine, but if you have to, obviously you can. So check me out on drerickprimex.com. I also have my weight loss at primexweightloss.com. A lot of cool new programs coming out. Please DM me if you want any of those discount codes, or if you want to learn more, and reach out to me if you have any questions. I hope you enjoyed this presentation and look forward to more videos to come.